The quadratus lumborum muscle is notoriously a tight and overactive muscle in people that have low back pain. The question is just how and to what extent. Here's what's commonly going on and what you can do to fix it. Because the QL attaches at the crest of our pelvis and the lowest ribs, it has leverage to do two main things when it gets tight and short. On both sides, it can create extension of the low back and help pull these two attachment sites together to arch it. Unilaterally, on one side, it can create side bending and it can pull the shoulder down and hike the hip up on that side. Surprisingly, one of my favorite ways to help address a tight QL on one or both sides is to get on a 45-degree hyperextension, but not in the way you may be thinking. Simply just laying over this piece of equipment in a position of inversion will allow us to get length and flexion through the low back, which will help create the length through this muscle that we're looking for. This is really good for down-regulating tension in that body and decompressing that spine, because a tight QL compresses the low back vertebrae and subsequently a lot of the upper segments of the vertebrae over time. If you don't have this piece of equipment, you could do this on a bench with a pillow like you're seeing right here. If you have low back pain and a lower shoulder and a higher hip on the same side, then that's likely an indication you have a tight QL on that side. If you're struggling with low back pain on one side and you have a hiked up hip on that side and a lower shoulder, that's a sign that you have an overactive QL potentially on that singular side. So doing something on that same piece of equipment but laying over it in this specific way can be really good for driving length through the QL. The goal here is to really help use the breath to open up the ribs on the back side, but even the front side of the body, because that tight QL is pulling the rib cage down on this side. So we want to help create length through the ribs. And we can do that by adding a little bit of an overhead reach and really emphasizing the in and out breath, in through the nose, out through the mouth. Every time you inhale, you should feel some nice stretch and expansion on that side that you're stretching out. So laying over this machine, but in a slightly different way, can be really helpful. Just make sure that your hand stays on your low ribs to make sure you're not arching or extending your low back. You can add an overhead reach because the goal is to help open up the rib cage that's being pulled down on the side of the tight QL. We want to help open up and expand this space and separate it. There's no better way to do that with the breath as an added dynamic component, both for the front and back ribs that are being compressed. As a progression, you can add a little bit of a side crunch to this, just making sure, again, your rib cage stays down, and this can train your abs to create more lateral flexion in a genuine way, rather than overly relying on the QL as a compensatory side bender.